Welcome everyone. We will get started. I don't know if we're expecting others, but let's get going anyway. Welcome. Thank you for attending. I notice a couple of new faces, so are new to the board today. So I just suggest we just whip round. I know we know each other, but let's whip round for the benefit of those that don't usually appear. So let's go left to right. Just let us all know who you are.
Simon Bryant, Director of Public Health for the Isle of Wight.
I'm Joe Smith. I'm the Chief Officer for the Isle of Wight NHS Trust.
Hi everyone, I'm Michelle Stanley. I'm the Director of Strategy Improvement for the Isle of Wight Trust.
Hi, I'm Jo Jeffries. I'm Associate Director of Public Health and I'm here to talk to the Public Health Strategy today.
Hi, I'm Emma Carina. I'm the Chair of the Voluntary Sector Forum and the Voluntary Sector Rep today.
Good morning, everyone. I'm Ashley Whitaker. I'm the Director of Children's Services for the Isle of Wight Council.
John Graney from Brading. I'm the IWOG rep this morning.
Jill Kennett. I'm what am I? I'm the Health Watch.
Thanks, Jill. Welcome all.
Morning, everybody. I'm Scott Redpath, Partnerships Director for the Isle of Wight. I'm working for NHS Hampshire and Isle of Wight.
Welcome, Scott. It's good to see you here. Good to see the ICB here.
Councillor Ian Stevens, Deputy Leader, Isle of Wight Council. I think I live here. I'm not sure, but
Karen Lucioni, and I'm a Cabinet Member, and I'm here in my capacity as Community Protection. So hello.
Well done, Karen.
Marie Bartlett. I'm Democratic Services Manager and I'm going to take the minutes for today's meeting.
Yeah, thank you, Marie. And Marie helps us settle these along with our officers, these meetings up. So thank you for that, Marie. And I'm Phil Jordan. I'm the leader of the council. So we'll move on to any apologies and changes. Eh? Is it?
Yeah. Oh, yeah, sorry.
Any apologies? It's okay. Any apologies?
I received apologies from Michelle Legg.
Yeah, Michelle is otherwise occupied and busy at work today, I understand, in surgery. So the minutes, those that were here, we need to confirm the record of those minutes. Any comments, any questions? I don't think there were any actions. I had a quick whip through. I don't think there's any actions. Ian.
just one point, the Isle of Wight Poverty Reduction Strategy has resolved that the members of the Health and Wellbeing Board take the strategy to their respective boards of governance. I just wondered on progress on that. Thank you.
Thank you, Ian. That's a good point. If there's anyone, John.
Sorry, I haven't the names here, but two IWOC members have been appointed, not me, to be part of that. So there are two names, and that might be one on a reserve or two members. I'm not sure.
Thanks, John. Any comments? I mean, Ian's raised a point there. Have we taken this away and had some discussions elsewhere, Simon?
So I know for the council, we have taken that through our cabinet. So Maria, I wonder if you can just take an action to email members afterwards and ask whether it's been through their boards. Ian, that's a great reminder. Thank you.
Okay. Are we happy with that? Ashley?
We've also discussed it a couple of days ago at the Safeguard and Children's Partnership. A very well received presentation about it, and lots of feedback about how useful it will be in terms of addressing some of the underlying causes of children coming into the statutory system.
I'll come to you.
And so I can confirm that it's gone through our trust leadership team. It hasn't gone through our trust board though, and we have had a discussion around it. Ashley, can we take that to the Youth Justice Board as well?
If the Youth Justice Board feel it would be appropriate to take the Youth Justice Board, we could certainly do that, couldn't we? And I think, as you're a member of the Youth Justice Board, I think that would be appropriate, wouldn't it? Yes, we can put that onto the agenda at the next meeting.
Thanks for that, both. Emma.
Thank you. I helped
Ian and the team with drafting it. So from a voluntary sector perspective, it's gone to our forum. We don't have a formal governance structure as such, but we distribute it. Most of us have a purpose for the relief of poverty, so it fits nicely. But I wanted to chuck it in later on the agenda when we look at our work plans, because Phil, it's got your lovely picture on the front, hasn't it? So I think there's potentially a role for the Health and Wellbeing Board as that kind of body making sure stuff happens.
Thank you for that. Are we happy, Debbie?
Good morning, everyone. Sorry that I can't be with you today, but for personal reasons, I have to work from home. With regard to the minutes, in a similar vein, I'm reliably informed by the officer that the poverty reduction strategy has also, we have confirmation that it has been to the boards, the relevant boards to be adopted. Chair, do you have your microphone on? Because I can't hear you.
You happy? Is anyone against noting them? Therefore, those minutes are noted. Any declarations of interest? There being no declarations of interest. Public question time. Do you have any public questions? And there are no members of the public here. We're doing okay so far. Chairman's update. This will be very brief also. The board has produced its 2025 pharmaceutical needs assessment, PNA. We love those, don't we? PNA, remember that, pharmaceutical needs assessment. And we're notifying you that the consultation for this report is now open, and the consultation will close on Friday, 21st of March at 11:59 p.m. So indeed, that's just before midnight. The aim of the PNA, is to describe the current future need for pharmaceutical services across the county. It provides an overview of current pharmacy provision for the Isle of Wight, what's provided, where and when, and assesses whether these services meet the needs of our residents, both now and over the 3-year lifespan of the document. The report also examines the health needs of the island's population relevant to the provision of pharmaceutical services. Well, I'd just add to that, and I think for potentially a future meeting, not for a debate right now, but is digital exclusion. And there was an event that brought this to my mind. There is actions that brought this to mind, and I understand some of the reasoning behind it, but I think it's worthy of further consideration, is that people's prescriptions are now not being renewed automatically by chemists, and people are being pushed towards using electronic means where they can, particularly phones and computers. That's an exclusion for some people, on the basis that the only other alternative is a physical visit to their surgery to produce a prescription on a regular basis. I think there's a digital exclusion going on that I'd like this board to at least look at, not specifically that, but a broader digital exclusion. So we'll bring that a little later. Karen.
I've had that brought up by residents, and I went to all these chemists in Ryde and was told that if anybody absolutely couldn't do it, they would still do it for them. But that, if and so the doctors have said that as well. So this is the chemists doing it, not the doctors. Thank you.
But I'll come to you, Simon, which is somewhat even more confusing. So, some may not. The exclusion goes on, doesn't it, Simon?
So coming up, there is an integrated care partnership workshop on digital access and digital inclusion. So with Helen Coleman on screen, we'll ask for feedback from that, and then we can bring that as part of our debate here.
That's all I have. So let's move on to the public health strategy. This is our pages 11 to 50, and it's to receive the update on the public health strategy for the next 5 years. Simon.
I'll start very quickly and then bring in my colleague Joe. So this is about our public health strategy for the Isle of Wight, really thinking about what are the key issues for public health for the next 5 years. And this paper sets out our vision and how we want to work together. Really important this board has sight and supports the implementation of that strategy. Joe, I'll hand over to you. I think you've probably got some slides and I've got the screen as well.
Thank you. I just want to make sure that I'll just turn it on. Before I begin, I just want to make sure that my colleague Eleanor, who is a service lead for public health, who's joined the meeting, is able to not just observe, but also to speak. She's on the screen. I'll carry on and hopefully we'll be able to bring Eleanor in. Okay, so as Simon has said, we're here to update the board on the development of the public health strategy for 2025 to 2030. It's a public health strategy for the Isle of Wight Council in its broadest sense, that has been approved and signed off by the council. So we're here to share the key points and to ask for you to note and discuss the strategy, to note the alignment between this strategy and the Health and Wellbeing Board's own strategy, and to consider the actions that the respective organisations that you represent here will take to support the delivery of that strategy. And so I'll move on, she said. Oh, that's the contents. So hopefully I'll get through all of these items as we move forward. The journey for the strategy began in the autumn of 2023. We started with some focus groups, a qualitative review. We really looked carefully at our joint strategic needs assessment and did some focused sessions with colleagues to go through the steps that you see on the screen. So the strategy is an evidence-based strategy, drawing largely on JSNA data, but also importantly on other qualitative information and insights that we've done on particular topics and in the development of some of our sub-strategies and local partnership strategies, such as the mental wellbeing, which Simon will talk about later. We have two strategic aims as a public health team and as a council, which are reflected in this strategy. To increase the number of years that island residents can expect to live in good health, so broadly improving health, and to reduce the health inequalities between the most and least healthy groups on the island. And that often means looking at health inequalities between different levels of deprivation, but it's not only that. We know health inequalities also exist between other groups on the basis of a whole range of factors, and there's a lot of intersectionality within that. We've themed the strategy ambitions into these three chunks, for want of a better word: healthy places, healthy people, and healthy lives. And I will go and talk through those in a little bit more detail as we go on. Our healthy places and community ambitions are shown here. And if you have a look through these, you will see that these are, in the main, actions that are taken at a strategic level to enable the creation and maintenance of the environments in which we live, to create people can find it easier to live healthy lives. So that's around transport, working closely and with colleagues in the council, thinking about air quality, really encouraging active travel, implementing healthy streets, and that might apply to regeneration and the development of kind of new developments. That links quite nicely into maximising opportunities to improve health through the council's spatial planning function. We want to make sure that we're working alongside colleagues to continue to raise awareness of the health implications of climate change, and to work with partners to ensure that when we are all working to mitigate the impacts of climate change or to try and reduce the potential for further climate change, that we're thinking about health in that conversation, as well as, say, impacts on the environment or impacts on carbon. We want to work with partners to tackle the health impacts of poverty. We have been through Eleanor largely and others in the team, particularly Emma, one of our officers, really working around some of the food poverty work and inputting into the development of that poverty reduction strategy along with other colleagues, and would continue to do that as part of this new strategy. And then lastly, to develop focused place-based work to improve health, including regeneration and strengthening social networks. And there are some instances of that where our public health officers are working at a sub-island level in a range of different places. And we've just listed some of the key indicators that some of this work would be monitored through. When we think about our healthy people ambitions, we're largely thinking about keeping people safe, and that feeds into the responsibility, the statutory responsibility that Simon has as Director of Public Health to have assurance that there are adequate health protection arrangements and adequate arrangements to respond to the health impacts of emergencies. So there's, when, you know, I think we all have still a strong memory of the way that we had to all pull together and work collaboratively during the pandemic. And there was a lot of input from the public health team in terms of providing some intelligence and interpreting guidance that made sense locally. We've all learned a lot nationally and locally from that pandemic, and we are continuing to ensure that any future plans to responding to new pandemics take account of that learning, that, you know, as far as we can as a council. We work alongside our NHS colleagues to encourage the uptake of immunisations and screening. Our role in the council is not to commission that service. Simon has a role to, again, an assurance role to seek assurance that those arrangements are adequate. We see our role as providing some intelligence around some of those social and other factors which may contribute to low vaccine uptake, and also through using our skills in behaviour change methodology to create effective methods of marketing. That may be social marketing, and it may be other routes by which we're trying to kind of grow that demand for those vaccinations and help people to have a good understanding, and not just of what the vaccination's for, but where to access and all that kind of thing. We work closely with the NHS to deliver effective infection prevention and control. And I think I've talked about the emergency plans. And then the Joint Strategic Needs Assessment sits in this box because it goes alongside other statutory responsibilities. So the Joint Strategic Needs Assessment, as you all know very well, is a function of the Health and Wellbeing Board, but the public health team operationalise that, create the infrastructure for it, pull together the data, and are there as a support to the wider system to interpret and use that information and intelligence. Again, we have some key indicators up there. The healthy lives section is a chunkier section of the strategy, and it's divided into a couple of bits here. When we talk to people about what our job is in the public health team of the council, we often say that about half our job is commissioning services, and the other half of our job is to be that partner to provide the intelligence, to help interpret, to provide that strategic leadership and join up the dots. So this page is largely about the first bit. It's about the services that we commission that help residents, largely preventative services. So that includes our domestic abuse service. We have a responsibility to work with others to tackle serious violence, to collaborate on delivering the national drug strategy. So that is through commissioning of our drug and alcohol service. We also have a statutory responsibility around the NHS health checks programme. And alongside that, oh, it has on my screen, so I'm not sure what I need to do. Can I move it? Now I can see 4. Yeah, sorry guys. where I'm going, health checks is linked to a broader CBD prevention programme that we're working closely with our NHS colleagues on. Oh no, I have no control over the numbers, I'm so sorry. And another commission service that again is a statutory responsibility for us to provide is to ensure sexual and reproductive health services are available for island residents and anyone who may be passing through the island. We do that through commissioning a specialist sexual and reproductive health service, but also by commissioning other elements from primary care in terms of long-acting contraception and commissioning community pharmacy to provide emergency hormonal contraception. We work really closely with our in the ICB who commission some other elements of that broader sexual and reproductive health pathway, thinking about terminations, vasectomies, HIV treatment and care. So we do that in a really collaborative way, working alongside colleagues from the 4 other upper tier councils in the ICB patch. We've also got a range of things around preventing mental ill health, so really promoting mental well-being. Suicide prevention work also fits under that umbrella. Then some of the things I think that many people, if we were going to go out on the street and say, what do you think public health do? We also commission services and do partnership work that with a focus on the common risk factors for ill health on the island. So that is around helping people to reach and maintain a healthy weight, to stop smoking, to reduce alcohol harms, and to become more physically active. And you can see that some of that work then feeds into the strategic planning work that we talked about before. We have a statutory service around public health nursing. So that's our health visiting and school nursing service. And we work in partnership to improve both physical health and mental well-being of those young people, the mums and families. We've got a real focus on the first 1001 days of life, so really supporting that best start in life from a health perspective. A lot of this work is much more of the partnership work, so we commission one element of that. I'll bring Eleanor in as we go forward, because we've also been working on the Family Hubs programme, again in a much more collaborative way. We want to develop more work focused on the middle-aged population. We realise that the island has a more rapidly aging population than other areas, and already has a kind of top-heavy population. So we want to support older adults to age well, and a lot of that is through our work on strength and balance and falls prevention. But we're also really aware that we need to kind of move up the chain and focus on people as they approach middle age, because some of those conditions which then would lead to frailty can be mitigated against if we get in there a bit earlier. So the NHS Health Checks programme is part of that, but we want to develop a bit more work around that more middle-aged population to try and prevent such a burden of ill health on those older people as they age. So I'm going to just pause here for a second. Hopefully you've kind of seen the broad brush of what we're trying to achieve with the strategy and seen the alignment with the objectives of the health and wellbeing strategy. Our next steps, we've developed a strategy. It looks very nice in the slide deck, but the implementation of that strategy depends on, much more granular, nuanced work. And we're now at a stage where we want to start building a more focused action plan to deliver some of those things. I think we're pretty clear on some of the things that the public health team will do. Some of those things we must do, and other things we're already built really effective partnerships to work on. Other areas will need more development. But in order to kind of build an action plan that sits for this 5-year chunk, we really need to get your support, your endorsement, and your kind of support to enable us to work with the right individuals to build action plans. And we're going to be doing that over the next few months. So these are some of the organisations that we want to be engaging with as we build the action plans. I'm just going to stop for a minute and bring Eleanor in as the service lead for the public health team here in the Isle of Wight Council. And Eleanor has been very much involved in the development of the strategy. and we'll be, you know, taking that forward at that kind of tactical and operational level, along with the public health team and other people in the council. So is there, Eleanor, is there anything you want to say about where we have had conversations already, or anything that you wanted to ask of members sitting around the table?
Yes, can everyone hear me? Just want to check that. Yeah. As Joe has said, it's been a developmental building of this strategy, and it hasn't necessarily come from a point of something incredibly different or new to what we're doing. It's really a consolidation of the work and helping us to really focus in on what our priorities and our ambitions are, so that we can be really clear as a team as to what we're working on, so that you know, we can demonstrate we're making a difference, but we are very much aligned with other strategies and other parts of the council, so that we're working in collaboration together. So it's actually been a really helpful process in also checking to see how much we do sort of support and fit in with other strategies, but also how we can make use of those other strategic approaches to be driving forward the work of improving the health of our population. So yeah, our next step really is to be articulating more clearly exactly how we're going to be doing these things. And like I said, it's not like we're not doing anything at the moment. We are actively working on all of these areas, but this is a time when we can be thinking about doing things in different ways, as we do all the time. We're constantly sort of adjusting and thinking about how we're going to focus on doing things in an even more effective way. And we'll continue to do that in a co-production style of way of doing things, by talking to colleagues that we work alongside within the council, but also in the voluntary sector and in the services that we commission and the services that other parts of the council commission, and with local community groups, right up to sort of the Portsmouth, Southampton, Hampshire, Isle of Wight wide type structures that the NHS work to. So I think partly it's sort of we're looking for that sort of encouragement as to that we're going in the right direction from a strategic point of view, but also to provide some assurance that hopefully these things that all feel really familiar to members of the Health and Wellbeing Board, that they are the right ambitions for us to be working on. Obviously, we, as I said, they've all come from the work we're already doing and checking in with others that this is the focus that we need to be taking. And then, yeah, as Joe said, it's partly my job to ensure that the rest of the team, so our principals and our senior practitioners and practitioners, have all got work plans that align to this, and that we know the focus of our work. So I'm yeah, kind of keen to hear what other people here are thinking of it. But yes, to sort of give you that assurance that we're not having a radical change from what we have been doing. It's like more like constantly adding to and adjusting and looking at the evidence that we of our local need and of what policy is sort of directing us to be able to get to this point. So yeah, I'm happy to take questions, but also I'm really happy to listen to the discussion people might have. I don't know if there's anything else you expect me to say, Joe.
Eleanor,
all good.
sorry, go on, Joe.
I'm just going to hand over to Simon to corral us in the discussion.
I think you're right. So there's something about, as a council, we have public health duties, but we all have to take a public health approach. So we'd really value engagement with partners. This is one of that process. So the team were meeting outside. So I guess one of the RCs is please really open your doors and let us in. The second one is we welcome comments. I remember Laura talking to us last time in the Health and Care Partnership about engaging with the communities, which we are doing in various ways. It's quite hard when you're talking about the whole population to do that at once. So we're doing it in different ways.
Thank you both. Thank you, Eleanor. Also, long time no see. I do remember the days when you came into the council from the NHS all those years ago in 2013, and enjoyed my time working with you all at that time. Would you like to speak?
Michelle, yeah. So firstly, thank you, and thank you, Eleanor, because I mean, I think it's a really good document. I really like it. What I was sort of writing down as you were doing this sort of presentation was really a kind of an interest of what the delivery plan would look like and the milestone plan. I'd really be keen to be part of it, and I also like the fact that you've made the connection pieces with the existing strategies as well. So I just want to say, I think it's a really good document. So thank you.
If you can grab a group of people from the trust to get together, we'd welcome that and to come and meet with you.
Emma, come to you, Ashley, after.
Thank you. I really like it too. And I really like that there are specific areas of focus to reduce those health inequalities, because you could end up very broad brush and think, oh, what are we going to do and what are we going to know? I have a question. It's really around kind of inclusion through the lens of disability and equity. And at the beginning of the document, there was a lot of discussion around the health impacts of disabilities, how you might be more likely to be the least healthy. But within the actions, I can't see anything specifically around the indicators around how would you know through the lens of disability that you'd achieved equity. So you might kind of leverage up the least healthy in one population, how you know when it's everybody.
Thanks, Emma. Who would you?
Thank you. I think it's a really good challenge for us to think about. And I think some of the difficulty is around recording of information that lets us know when we look at that population at large, what the differences in health outcomes are for people who have a disability. We do have some data flows that would enable us to do that. And working with our commission services, we're able to, we've got a bit more influence through our commissioning on the sort of information that they're able to give us. So, we could choose to work with the service to undertake some form of audit to help them think about particular populations. Where we've got some of our actions that are population-wide actions, then I think the devil's in the detail, and it really does come down to how we're developing that work. So, I'm thinking particularly about some of our strategic planning work. When we're, for example, the healthy streets work that we're starting to undertake, that is about creating places that enable everyone to be more healthy. And that doesn't mean what works, for the majority. It means really thinking about right through the life course, is this a suitable, does this enable older people to get out and about? Does it enable, people pushing a buggy to get out and about? Does it enable somebody in a wheelchair to be a part of their community? And we talked a little bit about digital exclusion, but also that kind of physical exclusion from some of those built and natural environments. That definitely is, would be part of the way that we would work.
Ashley.
Thank you. I want to say, first of all, I think it's a great strategy. Really welcome it on behalf of all the children, young people and families on the island. I agree, there's already some great work going on, and I think there's a lot more we can do. And it's an example for me of where the island is reliant on lots of different organisations and different strategies all combining and coming together to deliver improved outcomes. So we talked about the poverty strategy a bit earlier, and huge link between increase in poverty and increase in the numbers of children coming into the statutory children's services. And I wondered if I just want to give you a few examples, please, of where this really links into some of the challenges we have on the island around children. So you'll be aware probably that if you look at the reasons that children come into the statutory services, whether they need a child in need plan or they need a child protection plan, or indeed they come into care, and you unpack the reasons for that, there are essentially three main areas. One is around domestic abuse, one is around substance misuse, and one is around adult mental health. So all of those are massive priorities in this plan. So when we talk about early intervention and prevention, the better we can do this, the less children we will have in statutory services, right? That is really, really clear. So at the moment on the island, we have relatively high numbers. If you look at the numbers of children we have on child protection plans, the numbers of children we have in care, as a proportion of the child population, it's really high if you compare it, benchmark it nationally. Certainly much higher than, for example, our neighbouring authorities of Southampton, Portsmouth and Hampshire. We're much, much higher. And getting this right and doing more about this is absolutely key to preventing that escalation of need and reducing the numbers of children in statutory services. And in fact, last week, there was some really interesting national research that came out. You may have seen it in some of the national press that said that now nationally, the biggest driver of children coming to statutory services is parent mental health. And it's because that has deteriorated over years. It's now the biggest driver. So the more we can do around this, the less children we will have in statutory services. So it's incredibly important. The second thing I wanted to highlight as a real tangible example is kind of linked to what Emma was saying, actually, and it's about special education needs and disabilities. So in addition to having very high numbers of children relative to the size of the child population in the statutory services around child protection, etc., we also have very high numbers of children who have special education needs and disabilities. And of them, the numbers of children who require an education and healthcare plan for their needs to be met. In fact, again, if you benchmark that against the country, the island has the highest in the whole country number of education and healthcare plans as against the numbers of children we have on the island. It's the highest in the whole country. Now, again, if you unpick the reasons for that, there's lots of different reasons, and some of them relate to what's happening in our school system. And though a lot of it relates to what happens to do with this strategy. It's linked to what's happening around maternal health at the time of conception. It's relating to maternal health during pregnancy. It relates to what happens immediately afterwards. It links to the relationship between maternity services and health visiting services and the passing of information and the early intervention there. And it's all really, really connected. But again, the better we can deliver those services, the quicker we will identify additional needs, the quicker we will be able to get support in place, the quicker those needs will be addressed, the less escalation we'll have, and the less education and healthcare plans we have. So the whole thing is connected in a really, really fascinating way, I think. But this is why, you know, I think the strategy's really, really powerful. It covers all the right key points. The challenge now is to get into the action plan. Just to link to what Emma said, in terms of how we're going to measure this. So what we're doing around special education needs and disabilities on the island. So there are two statutory leads for this. One is the council and the other is the Integrated Care Board. So I chair the SEND Partnership Board on the island with Anthony Harper, who's the Deputy Director of Children's Care for the island. And we are in the process of doing two things. One is developing a strategy around how we're going to transform the special education needs and disabilities system from basically -9 months all the way up to 25 years, because our statutory duties go up to 25. So it goes right into adulthood. And it's a multi-agency plan. It includes those links I just mentioned between maternity services and health visiting services. It includes how we're going to engage with families, listen to their voices. It includes how we're going to develop pathways into adulthood, supported apprenticeships and the like for young people with additional needs. And the other thing we're doing is we're developing a performance dashboard with an outcomes framework, so we can actually look at the inequalities and how we're working to reduce inequalities and also deliver on the aspirations of our children, young people and families, not just our own. And we want to listen to them and hear what they want those outcomes to look like. So those are two documents which are being developed at the moment. But again, it's that real focus on early intervention and protection. And we talk a lot about, we're in the budget cycle, aren't we, at the moment? So lots of talk about money. The biggest thing we can do to address that is to do more prevention and early intervention, because it will reduce numbers in the statutory system and it'll improve outcomes and it'll reduce spend. And the third thing I'd just like to say is that in terms of what are people doing about this, action plans, etc. So in addition to public health needing to be really involved in that special education needs and disability transformation plan, first 1,001 days, etc., it's all in there. We're organising a conference. When I say we're actually very grateful to the High Sheriff, who is taking the lead on delivering a conference which will take place on the 3rd of June at the Riverside Centre. It's going to be called, let me just check I get the name right, Together for Children, Collaboration and Partnership. And what we've recognised is that the voluntary sector play a massively, massively, massively important role in all of this. And we want to bring them together for a day. And as I said, the High Sheriff is leading on the arrangements for this. And there'll be save the date going out within the next week or so to people. But essentially, it's to do three things. It's to talk about well, it's to basically thank the voluntary sector for the amazing work they do in this, whether it be in family hubs or supporting, pregnant mums or whatever it is. So thank them for that. We want to understand what the strengths are in the system already. We've heard there are already lots of strengths to do with this, but we want to understand them better so we can share that information. But we also want to hear from the voluntary sector, because they are the people who often know our communities really, really well. We want to hear from the voluntary sector about what they think needs to be done differently as an island community to better meet the needs of children and families, whether it be about child protection statutory system or whether it be to do with special education needs and disabilities. So everyone's welcome to that. If you're involved in a voluntary sector organisation, involved in supporting children and families, or parish councils, actually, some of them I know are keen to come along. Watch out for the Save the Day. I could go on, but I won't. Thank you very much.
Thank you, Ashley, for that. I was calling it pricey. It was a little more than pricey, wasn't it? But it was interesting nonetheless. We'll pick up on the mental well-being in our next item, but that was interesting. John.
I'm not a doer on this board. I'm an observer and reporter back. But one thing that occurs to me, and looking at this very comprehensive policy, I haven't found in it, and I read as best I can, anything to do with the extra health issues of closing school, adding 4 hours of travelling to a parent's day, because you can't pat a 6-year-old in the head and say, off you go to school in the next town. You've got to go with them. If you go on the bus, it's £12 return. If you walk, it's an hour. That's 4 hours out of your day walking. This is bound to have an effect on people, and it's going to be a big effect because there are hundreds involved.
Thank you, John. I'm definitely not going to get into the school closure debate here. We had 3 hours of it.
Whether the school closure happens is, by the by, it's the effect if it does.
Sure, I appreciate that. Thank you, John. Any further comments on this? I guess, Simon, I've asked this before. In terms of the strategy, some of it is statutory duties anyway. So what extent in the overall approach is there manoeuvrability outside of our commitment to statutory duties that addresses the things that Ashley is talking about, which is early prevention?
So it's a really good point, Leader. So I think from my perspective, what we've focused on through the JSNA is the things that are causing ill health. Our duty is to improve health. This is what this board does, and tackle health inequalities. So that then feeds into Ashley's point about actually there's inequalities in, as you said, the parents who are struggling more with mental health are going to have more challenges about parenting their children. So that's an inequality. So there is manoeuvrability because that's what we're doing. And I think that's why we want to talk to partners about where do we focus, best buy for public health, smoking cessation. Absolutely, you've got to get that right. And if we got the number of people smoking down to 0 on the island, smoke-free island, we would have much better health. It would impact on the mental health of the adults that Ashley's talking about. So yes, scope, but we've got to remember our duties are to improve the health of the population. We've focused on those things.
Simon, and is it fair? I'll come. Please.
Councillor Stevens, did you want to go first?
John, and I'll go.
I'll be quick. It's more of an addition to Simon's point that we have statutory duties to commission certain services, but we also have a statutory duty, our function, to improve health and reduce inequalities. And we know, as Ashley's, he's on my job for me, that doing the prevention piece in that is the most cost-effective way that we're ever going to shift, the seesaw. And we, in the public health team, and so in the council, are one of the only partners in the system whose job it is to not just try and do prevention ourselves, but our job is to get that system leadership around prevention and to, really kind of do that dot joining and bringing people together, aligning strategies so that we can, lift our gaze and push it into that preventative space, because it is the only way that we're going to make that step change.
Thank you, Joanna. Ian.
Thank you. I wish I wasn't a doer, to be quite honest.
Declaring it as a smoke.
All I want to do is highlight that you've got three objectives or headings: healthy places, healthy people, healthy lives, all interlinked. But when I start to think of the healthy places, sometimes, you know, and I look round here now, we've got no one from the social landlord contingent, if you like, or organisation. And I'm just wondering how we link in with those. And I know Laura's here and she's going to no doubt speak about it in a moment. But I've got my doubts that we do enough. And that's no criticism, because this is good. This is good, but it's what comes beneath it and the links that we can absolutely, and probably, as we all recognise, there are links already in place. It's just actually activating them, bringing them together. And probably you're doing that. But earlier on, when you did present the paper, you did say you wanted some information back in, and I'm just pointing the fact that health and well-being and healthy lives point to a healthy environment, healthy residents and housing, etc. And a lot of that is not within our gift; it's within the gift of others who are hopefully going around the island at the moment and upgrading various properties, etc. And I'm wondering how that links in with the JSNA stats and pulling that together and speaking to those people and finding out what's on their agenda and how they're driving it forward and how we can actually pull the things together. Because I really feel that there is the opportunity to utilise what they're doing to actually, which will make people's conditions better. But what we've got to look at is, okay, the underlying factor is, okay, there are people more susceptible and feeling the pressures than others. And really, if we could marry the two together, we'd probably upgrade the houses, but also catch those people early that we need to catch. But I want to say thank you for the presentation. Thanks for the input online as well. It's good.
Thank you, Ian.
I don't know if it would be helpful as a little sort of illustration of how we work across our whole sort of island population. Tell you a little tiny bit about the food partnership. I'll try and keep it brief, but the social housing landlords are part of that. And I just think it's quite a nice example of how public health do things that it's obviously it is part of our job, but it's also something that's a little bit different to some of the more typical things we do, say like the commission services or being involved in family hubs. So this is a bit of work that's grown very much over the last 2 to 3 years. Been very much driven by the food pantries and the food bank and some voluntary sector organisations, including Aspire, Pan Together, etc. And public health has been part of it as opposed to directing it or leading it, but they're very much wanted our connection, because we've also brought in environmental health and people working in waste and people working in planning at key points where there's been times when we've needed to talk to officers to sort of work things out. But they're very much have led things. So they've set up a process to be able to distribute food that's coming from supermarkets and from the fair share system, and they've worked those sort of things out themselves. And we're now getting to the point where we're going to have a food partnership. So instead of just looking at that food insecurity issues, which is very much from the ground up, they're constantly talking to people every single day about what their issues and their needs are. but that this approach is so much embedded in people being able to take control of some of their own issues, being able to spend their own money, choosing things that will work for their own family, but having a support system around them, because it also introduces them to the ability to, say, talk to CAB, to housing officers and other people that will help them organise and reduce some of the stresses in their lives by having those right referrals to be able to sort of tackle some of those issues. But we're now taking that broader. We're now going to be working with some of the farmers and agriculture. We're going to be looking at community growing. We're going to be looking at some of the biosphere issues. So some of the stuff that I would say the food partnership is going to touch on pretty much every single part of the council in some form or other. But we're also being quite careful as to what is, we're talking about our statutory duties, not overstepping, because we do what we do, but other parts of the council do what they do. And a big part of what we do is that collaboration and partnership working, so that we can all be working together. And then also sort of saying we can't do everything. So choosing one thing to focus on. Food is something that matters to absolutely everybody. There were definitely inequalities in terms of access if people living in rural areas. Just being able to get to the supermarket, can be a challenge, whether you've got, a good income or not. So this is a one strand of work we can do that's touching on so many things. So public health isn't intending to sort of be able to work on all of those housing issues, because that's for other parts of the council to do, but we are very much making sure we are including housing providers in the thought processes around what we can be doing. And some of that work is incredibly practical, but again, our public health officers aren't ever actually doing the practical stuff. We're working through other organisations who are doing it, whether that be parish councils or voluntary sector organisations, or charities, etc. So I don't know if that's been a helpful sort of insight into the sort of thing that we are doing, in addition to, say, commissioning big services from the NHS, etc.
Thank you, Eleanor. Ian wants to come back.
Just want to come back. I didn't expect you to do everything, but I expected you to actually, as you've already intimated from what you've just said, is to talk and eliminate any supposed silo working, making sure that we take advantage. And I don't mean just public health, but I mean the Isle of Wight Council, indeed the Isle of Wight, takes advantage of what there is on offer and pulls it together in a positive manner. So thank you very much.
Thank you, and I'm mindful of time to move on this not further, but I would say in that respect, Eleanor, as we know, back in 2013, to talk about the past, but part of the journey of public health was to integrate into the council at the time, and it was a struggle because I was there also, to get some service delivery areas of the council to understand how public health actually related to their service delivery. I know the struggles and trials you've been through as a team over the years, and I'm pleased because I see it. That integration is, whether it's perfect or not, I'm not sure, but it's certainly much more integrated than it once was. It's certainly not silo working, and that was very much the drive, wasn't it, when you came into the council, was to explain and demonstrate to officers of this council how your work sat with their work also. I'm very confident that's gone on. We're 10 years, 11 years down the road, 12 years now, and we shouldn't be complacent, of course, but I know that work's gone on, and we're a better place for it. So thank you. If there's no other comments, Laura, of course, I'll come to you. I'm sorry, and then we'll move on. Thank you, Laura.
Thank you, Councillor Jordan. And I guess it helps to put some factual context around your last statement. And I just wanted to provide assurance that until Councillor Stevens invited me to speak, I wasn't going to. And then I realised that might look slightly odd. As the Director of Adult Social Care and of Housing, a lot of this strategy relates significantly to the cohort of people that I support. The reason I wasn't going to comment in this meeting is because I've had the opportunity to comment on multiple occasions prior to the strategy coming to the Health and Wellbeing Board. The adult social care and housing strategy was developed with the backdrop of this new strategy and the previous work that colleagues in public health have undertaken. Our poverty strategy has been influenced by this activity, our dementia strategy influenced, our carers strategy influenced, and those cross and integration of strategies is part of what my team work very closely with public health to deliver. I think it would be also remiss of me not to recognise that the strategy enables me to deliver my services, be those housing services or social care services, the input we receive from public health colleagues, the data that they produce through our excellent JSNA, and the strategy itself enables us to do a much better job for local people. So I just hope that that helps to clarify. There is certainly an interface there that we find hugely beneficial in delivering support for vulnerable members of our community.
Thank you, Laura. I am going to move on. Thank you for your work on this. I will assume on our behalf it's a living document.
Yeah.
Tell me otherwise, and that, as in all living documents, that will develop with either help from us or generically itself. I'm going to move on. It is noted. Thank you, Eleanor, your team, Simon, and your team for bringing it to us today. Now let's move on to the mental wellbeing and suicide prevention plan, Simon.
Thanks, Susan. So just this board has an update on the mental health and suicide prevention plans. We did a really good member briefing, and this is a bit of a summary of that, but I wanted to mention that because it was jointly presented with the NHS provider, sorry, not the trust, but the new provider for mental health services, and the ICB with Dan O'Neill. So I'll give a quick update on where we are and show the really good work we're doing on mental health and suicide prevention. This is a slide pack of the paper. We know why it's important, as Ashley quite rightly pointed out. We know people experience poor mental ill health, and actually we are about improving their health and thinking about that population impact. And we know it causes time off work, and I've been really working with the ICP, so across the board, to think about those people who are off sick with mental ill health and what can we do as a whole system to improve that. We have a mental wellbeing index on the island. I really commend that to you. It was highlighted, and I just name drop when I can. Chris Whitty said it's one of the best things he's seen about measuring mental ill health and mental wellbeing. So it's not about sickness services, but it's about domains that impact on someone's well-being on the island. Not because Phil's from Ryde, but a little example of Ryde. I know it's Ryde Central, but shows that Ryde Central is more vulnerable for poor mental health. What do we do about that? It thinks about the indicators of an individual, the supports and the systems, and we can look at that across domains. It is a proxy, but it really helps us think where we need to focus on. I suspect in the police and other places, oh, that resonates with what you're doing, it helps. So we have a mental wellbeing plan on the island, and those are the objectives, and we really think about the alliance we have working together of voluntary back to you, Emma, lots of voluntary sector in that space, really supporting, whether that's their core business or kind of part of the kind of makeup of what an organisation does rather than the core bit. We really continue to tackle stigma and mental health and wellbeing. We really want to talk well of our mental wellbeing and think about how we use sensitive and kind language, and thinking about the capacity of our frontline staff, and there's an ask at the end. Our Suicide Prevention Alliance is really thinking about things that are going to prevent suicide. So we've got the mental wellbeing bit there. They're a kind of continuum, but not quite. So we're thinking about reducing access to the means, tailoring our approaches to particular groups, because we know some groups have more likely to be at risk from suicide. It's a really well supported plan in that space. And again, thinking about the language we use about preventing suicide. And I know many agencies are involved at the front line of that. And this is based on the national plan. So to keep nipping through, this really shows some of our key achievements in the last year. So we have done a lot of staff training on mental health first aid, suicide first aid. We are getting really good support for people affected by suicide. We know if you are experiencing suicide, whether that's close or even a little distance, it can impact on your risk of suicide. So we have a service called Amparo, which is absolutely excellent. Will support organisations and individuals impacted by suicide. A lot of work on workplaces. Again, really important to think about mental wellbeing of workplaces. The suicide prevention lead, and we're going to just work primary care, looking at Scott and how we really embed that in our primary care services, because we know people do access primary care if they're suicidal, but they don't say I'm suicidal, they go with something else. So how do we really help people to understand that? Working with education and also support for our Voices Collective. So you may have seen in the Minster, they've had a quilt that's coming back to the island. So please do take a postcard which shows where the quilt is, which has been developed by people who have lived experience of suicide or bereaved by suicide. The focus for next year continues. We have a person-centered language guide, and it's really important we promote that. And remember, using kind language can help. So what can we do? Please take up the offer of mental health first aid training. Could everybody, and I know that Councillor Andre's definitely done it, I know other councillors have done it. The 20-minute Zero Suicide Alliance training is absolutely excellent. I look to my trust colleagues, if you can promote that through, I suspect it can't be mandatory, but really promote that people could, help save a life when they're around and about, and it does make a difference. I've used it personally with people who've talked to me. Let's think about the conversations, share our person-centered language guide, which was picked up most recently in a national press saying, really interesting the way you're using that. So that's my ask for the board. So some clear asks on that last slide, Phil. I hope that was a quick canter, but helpful.
Thank you, Simon. Yeah, Michelle, sorry, I remember Michelle. I beg your pardon.
Simon, thank you for that, because it's for me personally really clear, and I like the fact that we've got the kind of key achievements that are mapped out. What I'm interested in is, are we able then to translate those key achievements into metrics so that we can actually see clearly we're making progress? And do we have those perhaps more strategic metrics, but anything where we've got watch metrics that we're able to track that give us that confidence that we are delivering?
So I think when we look at suicide, it's very difficult. We have very small numbers, that's very good news. But so to see that reduction is really challenging because, as you'll know, a suicide will be impacted on it by a number of things. There isn't good measures of mental well-being, which is why we've got our own index. I think it's pretty hard to measure, but if that's what we want to do, we know they're evidence-based actions, so they do make a difference. I'd love to think about how we can look at an indicator, but there is nothing out there. We had that happy score, didn't we, for a little while? But that was a bit that.
And I suppose it's fine if we are looking at them being subjective measures. It was just if there is anything that's more objective that we would be able to kind of pin and say, right, actually for this year we've achieved all of our outcomes and this is the data behind that.
Before I bring Jo in, she might have the answer, that when we talk nationally to colleagues, they are looking at this with the Royal College of Psychiatry so that we can actually measure something, because there's very little there.
Okay,
but it's a really helpful challenge.
Thank you.
Joanna.
There are some of the things are built into that dashboard, and I'm just thinking of, there are some measures that are nationally reported, particularly for young people, that are based on a kind of spot survey. So the information you get back for your area is modelled based on a national survey. So it's it's very much a proxy that we do track, and also then we also have some more bespoke work surveying, again, young people. So there's some of the work we do through the Be Well programme, jointly with others, that is very much focused on children's mental well-being. So I know it's only like one subset of the population, but there are some things that can contribute to metrics. But as Simon said, there's nothing that's absolutely, this is the thing that everyone's following.
Thanks, Joanna. Any further comments? I guess Simon, Ashley.
Really quickly, just on that, the wellbeing survey is fantastic, partly because it breaks down the children into really specific cohorts. And one thing we should be aware of, in addition to linked to the inequalities point, is actually children and young people with special educational needs and disabilities are more likely to have poor mental health than children and young people who do not have special educational needs and disabilities. So we need to be thinking about that as well. And we're including our approach around mental health within the special educational needs and disability transformation work. And something like, longitudinal look at annual wellbeing data might be one way of doing that, because we can differentiate between children with SEND and children without SEND.
Thank you again, Ashley. Any further comments? No further comments. I guess, Simon, what I was just going to say is just the link. We're going to be asked to note and support this, much the same way we could push this out through our organisations. But just explain the little link. Is this a 20-minute online experience? Or?
The training is a really good 20-minute online training. Emma's nodding, so I hope that means she's done it. Basically, and Laura's done it. It talks you through how to deal with different situations. So if someone, let's give a scenario. It's very sensitive, I gather that. So let's try and do this carefully and not, if you're finding it's difficult, please do step away. If you're seeing someone at a train station who is looking stressed, how do you approach that so that they can be safer? If someone phones you up, as my friend did, he said, I don't know what to do. I'm in a hotel. I was like, right, are you safe? No. So it just helps you have that conversation so that you can move forward. Should I say, we've also got life cards. So if you hold these, there is a 24-hour number locally for anyone to phone if you are suicidal. So we've got a lot of things. And how do you have those conversations? The training is just absolutely excellent. It just takes 20 minutes. And Emma and Laura saying too, I would just commend it to anyone and welcome feedback. It's on the slide. Go around to board members afterwards, but please take a life card and keep it in your wallet, purse, pocket, wherever you phone.
Thank you, Simon. And as I said, we're going to note this and support it. And I guess in supporting it would be to push it out through our organisations and ask your colleagues to spend 20 minutes of their work day, preferably not their work day, but if that's to be the work day's fine, to access this. So thank you. We can take that as noted. Any further, no further comments. And so we will move on to the discharge of people with dementia, delirium, Simon.
Thanks, Leader. I feel like I'm a bit of a second fiddle here. Michelle Legg had seen this document and said this is a very good document to highlight to the board. So it is here for highlighting. It's certainly not my area of expertise. So there are 8 high impact areas. And I think for me, it's about what we think about this board and what we're taking forward. I'm looking at Laura, who's going to smile and get me out the hole.
Over to you, Laura.
Thank you, Councillor Jordan. You're very welcome, Simon. I'll bank that. I am the system lead for dementia. I chair our dementia steering group, and the high impact change model was shared there first. Dr. Legg is part of our board and suggested that we shared it here so that the Wellbeing Board were also aware of it. In terms of what it is, it's a national document. It's been created to support the health and social care system in helping people who have dementia being discharged from hospital. We've taken a view as a system steering group that we need to map this new process, this new model, against our existing dementia strategy and the activity we already know is underway within our communities. That piece of work is ongoing, and we'll be delighted to share that with the Health and Wellbeing Board once completed. The high impact change model has landed at a perfect time for us because we're currently in the process of reviewing that dementia strategy, and I will shamelessly plug the dementia strategy working groups which are taking place in our community to access information from all people across the island who have a dementia or support someone with a dementia to feed into that new strategy development. And we'd be very happy to share that again with the Health and Wellbeing Board at a later point in time. The documents provided for information at this stage, and I can provide assurance that colleagues from our acute trust, from our foundation trust, from public health, from children's services, right across the board are engaged in that steering group, as well as independent sector providers and colleagues from the voluntary sector. So please be assured it's getting a very robust looking at and working over.
Quite robust, Laura, thank you. I noticed on the work, we'll come to our work plan later, but I think for July, for the health and wellbeing strategy, in July, will it form part of that? 26, July 26, it's a while away. Any comments on that? No comments on that. Well, we'll consider that considered, really, won't we? And we'll move on to the update of the integrated care partnership. That's our pages 59 to 72. And to receive a presentation, Dr. Scott, away you go and welcome.
Thank you so much. So I won't actually be doing the update from the integrated care partnership. My colleague Helen is joining us online, and she will take us through a bit of an update from the partnership. Also worthy to note, Simon and Councillor Andre are both representatives on that partnership as well. I think the exciting thing for me is having a look at what Helen will be presenting is the close alignment that exists with what we are trying to achieve on the island, and many of these strategies and updates that we discussed today, such as prevention, mental health, children and young people, are all reflected within our ICP strategy document. So Helen will take us through a little bit of a reminder on the partnership, how it's evolved, what their current strategies are. She'll also talk a little bit about issues and assemblies. I think we mentioned a little bit earlier, Simon, digital exclusion. I think the integrated care partnership is looking at that as well. So over to Helen. Thank you, Helen.
Thank you, Scott, and thank you very much for inviting me to come and talk this morning. I'll share my slides. Just do that.
They're sharing, Helen. Thank you.
Oh, good. That's good news. Right. So I won't go into, unless members want, a great deal of background into the integrated care partnership. As you'll see on the slides, there's that slide outlines some of the progress that we've made since sort of 2022 in developing the partnership, and that we have. It probably is worth mentioning because it is quite unusual, as we have quite an inclusive partnership where we have assemblies 3 times a year plus joint committees, and our assemblies are slightly unusual in that we do involve a range of organisations, and I think we found the value in networking and sharing good practice across place and system in those assemblies. So I think that is something that in Hampshire and the Isle of Wight we value and has been of great use. Just to remind members, there are our priorities, which fortunately do ring with the things that we've been talking about this morning. So we've got our children and young people, mental wellbeing, prevention, we've got workforce and digital, and I'll go into a little bit more of an update on the particular work we've been doing. So again, just to highlight some of the ambitions around those, which I'm sure that again would be things that members would appreciate and recognise. So in terms of what we've been working on as a partnership, so just to reiterate, the joint committee is it's actually chaired by Simon, and Councillor Andre attends, and Councillor Jordan has attended, and the Health and Wellbeing Board's chairs are key members of that joint committee, and our links with what happens at place is really important, and I think we are looking to make sure that we can strengthen that more as we go forward. And I think things like coming along to the Health and Wellbeing Board, and hopefully I'll get a chance to do that again again, just to strengthen our links and make sure that, you know, our programs of work, you know, where there's synergies, we can develop those. And we have programs of work and we do have activities around those. One of the key things that we've done last year is work with engaging young people around what's important to them in terms of health and social care policy. And I came to speak to the Isle of Wight Youth Council as well. And I think what we're to get their views, and I think what we'd like to do in the future is build those relationships. And we've got an action plan as a result of the assembly, which some people may have attended in November, which outlined a number of recommendations from young people about a range of things, including vaping, mental health support, education, work experience, all the things that kind of young people are concerned about. And we've got an action plan about that, and we want to go back and engage with those youth forums like the Isle of Wight one, but also Portsmouth and Southampton and Hampshire, to try and make sure that we're hearing the voice of young people. And also we don't want to duplicate what's going on, because there are some really great forums and really good ways of engaging young people. So that's been a good bit of work that it's been good to do and new for the partnership. Emerging this year is our workforce priority, and I think we, as a partnership, there was a discussion at the joint committee. Councillor Andre was there, and obviously Simon was there, and we were talking about what should be the focus. And I think it's very much that workforce health and thinking how we can help people who have ill health back into work. So I think that's something that the partnership will be looking at, and we have an assembly in March, and again that's that opportunity to share good practice and network. So that will be an opportunity to kind of kickstart a lot of the work around there, and obviously the work and acknowledge some of the work that's been going on. It was interesting this morning that you were talking about digital inclusion. We with partners conducted a digital inclusion survey last year, and we have an event in March again to look at the results. As I say in the PowerPoint, the top concerns were around staying safe online, about connectivity, and this issue around access and the physical impairments that people experience, which make it difficult to access. The survey very much was skewed towards older people, and so the learning that we're taking from that is primarily around access for older people. And we're aware that obviously there are other groups of people, but digital inclusion remains a real priority, and so we're working to have that assembly and hopefully have some useful things that we can feedback to help inform when we're commissioning services. Continue. So as Simon mentioned, we as a partnership, we've been promoting the various tools that support people. The mental wellbeing guide, really important. We're trying to support our ICP members to share that, to use it as a free resource. And we also had an assembly, a very successful assembly in September about trauma informed, and we've been able to, as a partnership, highlight that more and promote the self-assessment tool. And I was on a workshop the other day, and it's really impressive to see the amount of organisations that are getting interested and wanting to take part in that self-assessment. So that's something that we've been glad to sort of highlight and support. The other aspect that we have been working on is promoting social inclusion and supporting volunteering, and this is something that we've tried to do through our workforce focus. So how can we support our workforce to be more socially connected, because the health benefits that have, and also how can we support people to volunteer more and be part of their community. So in terms of the Isle of Wight, as I say, Councillor Andre attends, Simon Bryant is our chair, and we have excellent engagement from the VCSE. Sandy Belfoot is a fountain of much knowledge and support, and people have attended, as I say, the assemblies that we had last year, which were social connectedness, trauma informed in young people. I'm hoping that people will be able to attend the workforce one. Will be in March, and we will be having other ones in July and later in the year. So hopefully lots of opportunity for people to get involved. And I would just say, in terms of the joint committees, we have been having them in Eastleigh, but I think the plan is now to move those around more. So we will be visiting other parts of Hampshire and the Isle of Wight, which will be great. So that's really the kind of ICP update. I'm very happy to take any questions. I just want at the end really just wanted to highlight, in terms of the ICB, just to highlight our renewed ambition that was published last year, and I can send a link if people would like that, just to the focus that we're making around supporting people to get the right care and to stay at home as much as it's possible, and to and how we're focusing very much on health inequalities. So those are, you know, our kind of ambitions. And just to highlight again, as people will have seen, the Darcy report and the 10-year plan, and how we're our renewed ambition chimes very much with that, around making sure we have the community care, that we're trying to move to digital, but obviously being aware of inclusion, and very much a prevention agenda. So that's really, you know, our focus. Are you happy that I've end there, and then I'm very happy to take any questions?
We're okay there, Helen. Laura, did you want to speak, or would you don't?
Can I make?
Yeah.
Sorry, I completely forgot. I made myself a sticky post-it note so that I'd remember. I knew I would get engrossed in the next bit. There were two things I wanted to follow up on, if I may. The first, in terms of the programme of the ICB to support people into employment, I just wanted to suggest a link with our system workforce group. We know that we struggle with workforce across health and social care on the island in a variety of different roles, and it felt to me that we could combine two activities and deliver against two of our challenges. Firstly, supporting people from worklessness back into employment, and secondly, addressing some of the workforce pressures we see across health and social care. My second comment was in relation to social inclusion and volunteering. I found the update hugely interesting, and I wonder whether there's more information that can be shared with partners so that we can ensure we're getting involved as well, rather than it being limited to health partners.
Thank you, Laura, for a couple of very good points. Simon.
If I take off my ICP chair hat off for a minute, and we're an Isle of Wight Health and Wellbeing Board, it's really important. I think, Laura, you've board's views are really fed into the ICP, because actually that's bringing together 4 health and wellbeing boards, and each place is really, really important, and we're in the place of the Isle of Wight. So as you say, Laura, those things are really helpful to hear coming down, but actually what do we do, the learning we can take from the island, and what are the island challenges that we need to build up. So it's that challenge, and I take that as chair in that role, but I'm also taking it as the health and wellbeing board link with Councillor Andre. Laura, if we can just chat aside to make sure it's really there, because I realise I've got a couple of complicated hats to carry.
Thank you, Simon. That's encouraging. Any further comments? Ashley?
Obviously, I have to speak on behalf of children at every item. I don't think the dementia strategy much, but just to all the integrated care board colleagues, thanks very much for that and all the work you're doing, because I know it's a time of lots of change. And I want to first of all just say thank you for the great partnership work and collaboration that's going on with ICB colleagues around children's services, because, you know, we regularly have ICB colleagues sitting with us on the 3rd floor in here. Everyone's always welcome. We see everyone as being part of one team. And I'm talking with colleagues also about whether there are opportunities for joint roles and that sort of thing, because I think it's a really key area. A couple of other things I want to say. You know, one area we need to do more around is commissioning. So joint commissioning, or where the ICB needs to commission services bespoke for the island, because I get a lot of the work around the full footprint and the benefits that come from that, but we have to recognise, don't we, that the needs of the island population are different. to the rest of the patch in many areas. So we need to make sure that what we commission is bespoke. I'll give an example of commissioning where we know we need to do more work, which is something that the Local Government Association raised when they did a Send Peer Challenge of the island in the autumn. It's around the fact that if you're over 5 and you have speech and language needs, you can only get support if you have an education and healthcare plan. This is not right, because what it means is that there's lots of families who know that the only way they can get speech and language therapy is to apply for a plan, whereas that introduces them to a hugely bureaucratic system, 20-week waiting list, blah, blah, blah. Actually, let's just give it to them up front. The needs will escalate less, they'll get it quicker, everyone will be happy. So that's just an example. And your colleagues are aware of this, it's on the list, but we need to make sure that when the new spec comes out, that it does reflect that and we have adequate capacity in the system to deliver it. Because again, it's like when we were talking about public health, these are the key drivers of the volume of children in the statutory system. We have to shift the focus back to early intervention and prevention. So that's just one example of the way that I think we need to commission differently. And then just linked to what Helen was saying about participation and voice. You know, again, it's great. Helen came over and met the Youth Council. And I think the Be Well survey is a good example of where it has to be bespoke to the island. And really interesting. I couldn't make it to the forum in November, but I heard some great feedback about it. I guess the thing about that is if we're then going to use that feedback from young people, it has to be from island young people, because what island young people will say about transport, pathways into employment, mental health is probably going to be very different to what their peers in North Hampshire say about it, or Southampton. So we have to make sure that everything, when we're deciding what to commission based on what young people are saying, it has to be about island young people, not the bigger group. Thanks.
Thank you, Ashley. A point well made. In our brave new world of devolution as well, potentially something we need to be very aware of from the outset. Thank you for that. Ian.
I don't know if it's the right area of the agenda that I should bring this up, but Ashley just mentioned about contracts and working with people. I'm just interested, and I've always been interested in trying to extend contracts from 1 to 3 years, etc., etc. So there's continuity and the hiring of staff, professionals, those with talent, those with experience, especially in the voluntary sector, and indeed our contractors. And we come to say the end of a year or a 3-year term, and we're waiting to see if we've got funding to continue with a worthwhile support, and with the positive outcomes that we look for. And yet there's no money until the cut-off date, and then we start again. And it seems to me, and with the ICB, we might want to have an opportunity to turn around and say, yes, we can, if you look, for want of better words, a pool of funding to actually get some of our contracted outsourced organizations that comfort factor that they don't have to give in notice to their staff with the possibility of losing them and then trying to re-engage and bring them back on board or keep them on board, with the possibility there might well be a continuation of the contract for another 3 years. And I just feel that sometimes we lose the opportunity to have that continuous involvement, that continuous level of support. I'll just throw that in there. Probably the wrong time, Chair, but I always look for an appropriate how can I say, soapbox to climb on, and just have a quick word about my concerns for making sure that those people out there get the grade of service that they deserve and need, and making sure that we don't throw away the opportunity to keep these organisations on board, basically because they want to give the service, but suddenly, because of the end of a contract or something like that, they've had to give notice to their staff. Their staff are obviously looking for other areas. I just feel that what we need to do is safeguard those future opportunities to provide support for our residents in Needham. Leave it at that, Chair, and I don't expect anyone to come back. It's just an airing that I had to give, and probably an inopportune moment, but I've
Too
aired
much
it.
coffee.
My coffee's there, don't worry, I'm 2 spoonfuls in there. Thank you.
Thank you, Ian. Those comments are noted. We're not going to come back to it, but thank you, they are noted. Any further comments on this? There being no further comments, just a quick one from me, and it's a sort of cute thing, and I know you're going to comfort me, Helen, but you know the survey you did, I'm not bashing on about digital inclusion, please tell me it wasn't done online. Just give me some comfort.
I don't
Helen,
know if
you're
I can
muted.
speak. Oh, I am. I don't know if you can hear me. Sorry.
Yes.
Yeah, so it wasn't exclusively online, but there was an online link. But yeah, I think that is one of the challenges. But
Helen, I'm not putting you on the spot, and we'll come back to it. Thank you. I've certainly
you.
not, there's no criticism here, but I think the point's made. Let's move
Absolutely.
on.
Thank you.
Sorry, and we will move on to the Better Care Fund. You're doing that, aren't you, Laura, please?
I am, thank you, Councillor Jordan. In terms of the Better Care Fund report before you, it's the Q2 return. The ask is that you note and approve that return. It's no surprise to this committee. The board receives the annual report together with quarterly reports at quarterly instalments. I can confirm that the Better Care Fund is on track. It is delivering. We've just completed our Q3 report that will come to you in due course. It remains on track and it remains delivering. So I'd ask simply that the committee execute the recommendations within the report. I am happy to take any questions, and I know that Scott will also be happy to accept any questions on account of the fact that it's a joint partnership agreement.
Oh. Solving all our partnership issues, are we, Laura? Good. 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 It's good to hear. Thank you. Any comments? Any questions? Is there anything, therefore, that you would like to information you have about the future of the Better Care Fund?
It's probably best I decline to answer that question for fear of mirroring Councillor Stevens' soapbox approach.
Well,
the Better Care Fund is currently going through, I shall call it a transitional phase based on the changes we've seen in central government. The guidance for the financial year 25-26 was promised on the 16th of November. It's been redated on multiple occasions. I was almost assured it 2 days ago, and it still hasn't arrived. So in terms of what we're looking at for next financial year, I'm really sorry we're completely clueless. My heart is hoping it will be quite a simple rollover with less red tape and less reporting requirements. But what we do know is that from 26-27, there's likely to be a significant change in the Better Care Fund, its purpose and what it's used to deliver. For local authorities, that creates quite a challenging situation because, as members of the board know, the Better Care Fund requires the Integrated Care Partnership, our health partners, to make a mandatory contribution towards social care services. If there is any change in the way in which that is funded or how that funding flows to local authorities, there will be a number of our core services that we will no longer be able to afford to deliver. those representations have been made to central government very loudly and very clearly by the Association of Directors of Adult Social Services, by the Better Care Fund, by the Local Government Association, and by NHS England. We are all on the same page in this piece of work, and those are messages that are being factored into the development work that central government are undertaking around the Better Care Fund. So I could say much more. I could express some very detailed opinions and share many more views in relation to the situation. I suspect it's probably best that I don't. It's a watching brief. We're working closely together. As soon as we have that guidance, we'll start planning for the next financial year.
Thank you for that update. That's helpful. Any further comments? There being no further comments, we'll move on to our work plan. I don't know if you have a copy. I've been sent it. Are there any? If you have you seen the work plan? Ah. Well, see if we can share this. I mean, really, this should have been sent round, to be honest. But anyway, there we are.
In a sensible way, Marie, is I think we do need to pull out some actions from today, particularly Laura's mentioned the dementia one. Marie, should we circulate it afterwards? And can we just really ask the people to put items on there? I'm also fully aware, looking at Joe and Michelle, that we haven't got the foundation trust around the table. We might want to think about that as well. That's probably just an error in my point. So because of things around mental wellbeing, they should have been here. But sorry, I'm looking at you because you used to have them.
Yeah, particularly from the agenda items and the default agenda items are just their default go on all meetings, but the agenda items from halfway down there, starting joint strategic needs, JSNA, and then at the bottom, because the health and wellbeing strategy, there's no population at all there of any work plans at all. So as Simon said, we would like to populate some of that with some of the work needed. Laura.
Chairman, I wonder if I could ask for a change to be made under the Better Care Fund line. It's currently allocated to or delegated to Ian Lloyd and to myself. That should be to myself and Scott now. And similarly, I wonder whether the committee wish to consider an update around Care Quality Commission and assurance of adult social care, but also assurances of integrated care systems, because both are now up and running.
Thank you, Laura. That's noted. We'll change that, and we can add that.
And I just think we do need to look at the health and wellbeing board priorities. I'll talk to Laura outside, but I think we had an item plan, but there was a bit of a change in staffing, so we were trying to find the right time. And inequalities, you've heard, is part of the public health strategy. How we really talk about that in a very detailed way is quite complicated. So let's think about how we can present that as a discussion point at the next future meetings.
Any further comments? Emma, please.
Thank you. I was just curious about where the poverty reduction strategy might fit in our timetable.
Yeah, that's come through this board for sure.
I suspect under our health inequalities items, but let's think about how we make sure that's really clear, that we get an update on that. That's really helpful.
Yeah, good point. Thanks, Emma.
Laura's nodding, so I've really got it right.
Yeah. We'll circulate this, by the way.
In May, we, this is the Isle of Wight Council, have a change of governance. Now, how will that impact on the Health and Wellbeing Board?
There's no impact on the Health and Wellbeing Board.
So we will still have a leader, deputy leader, and obviously people who are at this moment cabinet members attending, and the change of governance will still keep cabinet members from the various portfolios. I didn't think that was going to happen. But I note that after April, the next meeting is July, and want to make sure it should be, will be totally different. Well, the governance will be totally different. The attendance might be so totally different from the members' side rather than the officer side. I'm just a little bit concerned. I want a smooth transition. Thank you.
Ian. We are as confused as you are, or certainly I am. We will ask about that and come back to you as a board. Other than the Health and Wellbeing Board will continue with some representation of this council. Quite whom or in what role, we're not sure yet. Ian.
Can we make it, can we make it that we bring it back in April so that our partners around the table at this moment in time are aware of what the changes will be, if any? Thank you.
We'll bring that back in April. Thank you for that. Any further questions? There being no further questions, thank you all for your attendance, for your commitment. Ashley, for your, it's quite valuable. It's been, a while, but we have the children's aspect brought in, which is very important to us. And your time and effort and energy for being here. It is appreciated. We've done about an hour and a half, not too bad today. Well, my diary's got 3 hours, which I look at in the morning. It's starting at 9:30 and half the day's gone. But we've managed to pull back some of our time, take the rest of the day off, and
I'm allowed.
and see you.
Let's go. He's the boss.
See you soon.